I usually encounter very many questions from my patients. So one of the questions, why does my child snore, doc? And why does he keep his mouth open while sleeping? Well, a child snores when there is enlargement of the adenoid gland. And because the adenoid gland is enlarged, the child is not able to breathe through the nose. And then the child has to do snoring and he has to keep his mouth open. Next question comes, doc, what is the adenoid gland and what is the importance of the adenoid gland? Well, adenoid is a gland which is situated behind the nose, at the junction of the nose and the throat. So when the adenoid gland's function is to provide immunity at a very younger age. As the child grows up, adenoid itself gets infected and gets enlarged in size, and that causes problem. The enlarged adenoid blocks the nose, and the child has to then face the difficulty in breathing through the nose. Next question, doctor, how do you diagnose enlargement of the adenoid? Well, when a child comes to me in the clinic, I usually examine the nose with the help of an endoscope. The endoscope shows me the back of the nose where I can see whether the adenoid is enlarged. If the adenoid is enlarged, I try to see how much percentage of the airway is involved with the adenoid. If it is involved more than 75% of the airway, then the child naturally will land up into breathing trouble, causing snoring and mouth breathing during sleeping. Doc, can adenoid be treated? Well, adenoid can be treated both with medication and surgery. So when the child first comes to me, I just check out if there is any infection, then I give an antibiotic for the infection, or otherwise I give nasal steroid sprays along with saline sprays that usually is continued for about 2 to 3 months. The child's adenoid slowly shrinks in size and the child is able to breathe better, which resolves the problem of snoring and mouth breathing. But sometimes, even after the medical treatment for 2-3 months, the child still continues with the complaint of snoring and mouth breathing. In that case, we usually do a surgery to remove the adenoid. The surgery is done with the help of a special instrument called cobbler, which removes the adenoid in complete totality. So, doc, is the surgery dangerous? No, the surgery is not dangerous. Usually it is done under general anesthesia, so that keeps the airway safe from bleeding. So when you remove the adenoid, there is some bleeding that occurs, but usually we are able to manage it with special instrument called coagulation cobbler. So we use a nasal endoscope to view each and every site of the area from where the adenoid has been removed, and if there is a remnant, then we immediately remove it with the cobbler, and if there is bleeding, we usually are able to control the bleeding with the help of the coagulator. Now, after the surgery, the child may have some pain. That doesn't bother a lot. The child can be on painkiller, and usually the wound heals in about 1 to 2 weeks. Doc, what if the adenoids are not taken care of? Well, if the adenoids are not taken care of, then the child will be getting less oxygen while sleeping, and that can cause some problems with the heart, like enlargement of the heart, or we call it as the cor pulmonale because of continuous obstruction. There will be less oxygen going to the brain, so the child's growth will be hampered. The child won't be able to focus on her studies or won't be able to participate in the sport activities which requires a lot of effort, like football and like going to a trampoline. And above all this, the child may have recurrent infections of the ear because the adenoid gland is just situated at the opening of the eustachian tube, the tube which connects the ear with the nose. So if the adenoid gets infected, infection easily ascends from there and goes into the ear. That sometimes the child will present with earache because of that infection. Second thing, the child can slowly develop sinusitis because now the secretions cannot flow back into the throat, so they come back into the nose. They cannot flow into the throat, so they come back into the nose. These secretions are from the sinuses. They are normal secretions. So when the secretions, they reside there in the nose for long, then the bacteria start growing inside it, and that causes problem as sinusitis. When there is long-term sinusitis, then the child may face problems of sinusitis like nasal obstructions, scanty bleeding from the nose, or the child may have a headache with facial pain. Now, if suppose the adenoid is not removed for long, then there will be some changes in the face. The upper jaw will come forward, and that we call as the adenoid faces. You might have seen some patients, some children whose upper teeth are little forward than the lower teeth. They don't close, and this is called adenoid faces. And this causes some abnormalities in the dental occlusion as well as the teeth shape, cosmetic appearance of the teeth. The last question that is asked by many patients, that doc, how much is the cost for this surgery? In UAE, the cost is about 10,000 to 14,000 if you're getting done from Astor Hospital, Sharjah. And but if you go to Dubai, the charges will be like above 15 or 16,000 depending on your insurance scheme. There are different categories of insurance, and depending on the insurance, the charges will be decided. It is actually decided by the payer of the insurance, not by the hospital actually. Thank you very much. That was all about adenoid hypertrophy. See you next.